Well, a warm welcome to this talk. It's Wednesday evening, the 19th of October. Now, we've been looking at excess deaths lately. These are deaths more than we would expect based on the 5-year average. And the Scottish Government has just ordered an inquiry into a raised death rate in neonates. Now, obviously, neonates, newborns. The first days of life, it can be up to the first week. Typically, we would say a neonate's in the first week of life. Some people will extend that to 4 weeks, but it's basically newborn babies dying at a higher rate than expected in Scotland. Now, Scotland's only got a population of just under 5.5 million, but it does collect very good data, unlike the United States, for example, where the data can be somewhat disparate from different parts of the country. So it's good to get data from these small European countries where data is well collected. And this is very concerning. Let's dive straight into it. This is review of neonatal mortality in Scotland. Now, this comes from here, Healthcare Improvement Scotland. So an official affiliated government body is investigating this. Healthcare Improvement Scotland, asked by the Scottish Government, so this is a formal request from the Scottish Government, review of significant increase in neonatal mortality 2021 and 2022. Now, the BBC has actually unpicked some of the information here, which is accurate, so let's look at what they've said. Scottish Government orders review of neonatal deaths higher than expected. Neonatal deaths, 2 particular spikes over 6 months have been noted. September 2021 was the first one. At least 21 babies under 4 weeks died. Remember, this is from a population of just 5.5 million. Now, let's hope this isn't duplicated in somewhere like the United States or in England, but if it was, you can see the numbers would really be getting quite large. Something we certainly need to get worked out. March 2022 was the second one. At least 18 babies under 4 weeks died. So they are taking the neonatal period as up to 4 weeks there. Now, the average mortality rates amongst newborns is about 2 per 1,000. Now, tragically, this does happen. I mean, children can be born with various problems that can result in their death in the first few weeks of life. This is tragically the case. We know about this. We've minimised it, and there's further steps possibly could be taken to minimise it even more. But at the moment, it's about 2 per 1,000 births. So tragic for the 2, but low, basically, lowish for 2 per 1,000 births. Now, in September, in March 2020, that should be 2022, sorry. So September 2021, it was 4.9. March 2022, it was 4.6. So we can see the rates here are double what we would expect them to be. And for all of 2021, the year taken as a whole, again, much higher. It was 3.9 for the year as a whole, and 2020 was 3.1. So increasing here, apparently, year on year. Now, a preliminary investigation. So this has been investigated. We don't have the details of this, but there was a preliminary investigation found the September spike was not linked to COVID. And this form of monitoring was introduced in 2017, so that's 5 years. This is definitely the highest for 5 years. And other sources are saying it's the highest for 10 years in terms of neonatal deaths. So what is going on here now? This is a report from the Scotsman newspaper, national newspaper in Scotland, Dr. Sarah Stock, University of Edinburgh. Direct quotes from Dr. Stock. I think the numbers are really troubling, and I don't think we know the reason yet. What we do know is it's not neonatal COVID. So we can be confident it's not neonatal COVID. The rates of COVID infection in babies are very low, and deaths from COVID, thankfully, are very, very small. So that is true and good to reinforce. So this isn't COVID affecting babies, so it's not COVID related. Now, Other information coming from Public Health Scotland. COVID Scotland. This is another well-known Scottish newspaper, the Herald, reporting COVID Scotland vaccines ruled out in neonatal death spike. According to this report from the Herald, public health experts ruled out any link between spike in neonatal deaths and the COVID vaccine. But the Herald does note this was without checking whether any of the infants' mothers had received the JAG during pregnancy. Experts stressed no plausible link to justify investigation of maternal vaccination status. So they're saying there's no need to investigate the mum's vaccine status in these babies that have tragically died in the neonatal period. This is not necessary. Public Health Scotland said its consultants had given careful consideration to the potential benefits and harm of carrying out such an analysis as part of its probe into the tragic death of 39 infants, but concluded against doing so. Public Health Scotland added, so the Herald's got this from different bits and bobs, some are freedom of information requests and other statements. They've put it together. There's a risk that identifying the vaccination status of the mother, even at aggregate level, so in other words, that's not individuals, it's just going overall percentages and numbers, even that would result in harm to those individuals and others close to them, which of course we wouldn't want. Through actual or perceived judgment of the effects of their personal vaccination decision, the outcome of such analysis, while being uninformative for public health decision making, had the potential to be used to harm vaccine confidence at this critical time. So information regarding this would be uninformative for public health decision making. So NHS, this is a Freedom of Information response here from Public Health Scotland. We do not have any plans to examine maternal vaccination status, as there is no public health reason to do so. So it's reassuring to note, isn't it, that Public Health Scotland can be so confident in the safety of the vaccines. Now, this is a report from another English newspaper here, The Telegraph. NHS logging baby deaths as stillbirths to avoid scrutiny, according to this investigation from The Telegraph. Now, this is a very reputable English newspaper. Families called into question trust transparency after hospitals' accounts clashed with their experiences is the subheading. Direct quotes from the article: NHS hospitals claim that babies born alive were stillborn. So they claim the babies were born alive, but they claim they were stillborn. Promoting accusations they were trying to avoid scrutiny. 6 children who died before they left hospital were wrongly described as stillborn. Several of the children lived for minutes, one lived for 5 days. Now, why is this differentiation between being born tragically without any signs of life, stillborn babies? Why is this so important to differentiate this from a child that lives for minutes, hours, days, 5 days after birth? Well, this is from the UK government side here that we're going to look at just briefly. That's the link there. At present, coroners can only hold inquests for babies who have shown signs of life after being born. Coroners in the UK have no powers, no jurisdiction to investigate stillbirths. So if a baby is stillborn, outside the jurisdiction of the coroner. If the baby is born and shows sign of life for a few seconds, within the jurisdiction of the coroner. Now, the coroner system in the UK is one that we just can't be thankful enough for it. We've had coroners since the Middle Ages in this country, and it's just a brilliant safeguard to safeguard me or anyone else against death will still die, of course, but the reason will be investigated. So coroners are a truly magnificent British institution, one which we adore. And unfortunately, they don't have powers to investigate stillborn children, so it would be distressing if children who were showing signs of life were classified as stillborn, because it would take them out of the protectorate of our great coroners system. So that's quite serious, really. Direct quote: "The babies identified by the Telegraph should have been recorded as neonatal deaths, but staff claim they were stillbirths." And I'm not going to go the individuals and the trust. They are named if you want to read the article. I've put the link. One distressed couple, our baby was alive for 5 days, but we were recorded as a stillbirth. Not what we would expect from professional healthcare providers. We would expect total honesty, integrity and transparency, from which we have from the vast majority of them. I've done it myself for over 40 years. I've worked with some of the highest caliber people in the world. It's a pity that there's been this difficulty in a vast minority. Now, I just want to finish with a few of your comments, really. I'm just going to give the initials of the people that commented, because I haven't asked them individually. It's all in the public domain. If you want to look through, you can find these comments. If you want to look through amongst the many thousands of comments that I'm delighted that we receive on this channel. But they do say quite a lot informative about the issue we're looking at excess deaths at the moment. Jay says, "Unfortunately, my wife is a hospital healthcare worker here in Ireland, and she has been saying for around 4 months now that they are seeing a massive increase in young people, males, in particular deaths. She's afraid to come forward on the record and report what's going on for fear of losing her job." So not pleasant reading from Jay, but thank you, Jay, for reporting. G from Canada. "I live in a small Canadian town, population 8,000, one funeral home, with a 20-year online database which makes analysis easy. Annual deaths totaled 120 consistently, about what you would expect. For 2020, we reached 120 on September the 30th. All deaths over the next 3 months are excess. Born and raised here, so these are not just numbers, these are family and friends." T says, "I'm a funeral director from Canada, and it's not much different here than Australia, because we reported on the excess deaths in Australia, and the UK also has high excess deaths. The number one cause of death in Alberta is unknown." M. "Well, I live in Australia and I still don't know anybody who died from COVID. However, I know quite a few people have mysteriously died or got very sick in the last 2 years. The latest 2 just weeks ago. She was a real estate agent in my village." Now, the village is named. I haven't given it for decency reasons. "She'd just come back from an Italian holiday, was in perfect health, went to bed and was found dead in the morning." So tragic, of course, but I'm afraid these count towards the statistics of increased excess deaths that we know we have in Australia, that we know we have in the United Kingdom, and let's hope the Canadian official data it becomes more obvious soon. So sorry about that. Distressing subjects, but one we really need to get to the bottom of. We need to find the reasons why this is happening, and these reasons then need to be publicly acknowledged so they can take their place in the annals of health, education and advice. Thank you for watching.